Hello, my name is Dr. Agnieszka Adamczyk. I'm the owner of Back to Life Physical Therapy and Wellness. I'm very happy to be a partner with Arrow Trans Corp, and I specialize in manual orthopedic physical therapy. I treat patients with a variety of conditions, both musculoskeletal and neuro problems. I treat patients with different back aches, pains, neck pains, injuries, sport injuries, as well as simple postural dysfunctions. And today I'm here to show you a few tips on how to prevent potential injuries during work activities. Let's start with your correct posture. So in today's age, we do a lot of driving and sitting in front of a computer. So what we want to do is make sure we sit in the right position if we have to do it for extended period of time. So we come in and we sit in a chair, whether it's in the car or in your office chair in front of the computer, and then make sure you sit all the way in the back of your seat so that your tailbone is touching the back of the chair. This way you're not kind of setting yourself up for a potential slouching injury or sitting too forward and kind of in the beginning of the chair. So all the way back to the seat, make sure that you're sitting evenly. So each leg has to be straight out and you're not slouching to one position versus another. Especially driving, you want to avoid this leaning over position because then you're sitting more to the right side versus the other. So you want to sit 50-50 on each butt cheek, 50-50%. So you want to sit evenly. Your legs should be extended out also about the same length. Very important is their pelvic position. Oftentimes people get stiff, it's kind of hard to sit in the same position for a long time. So what I recommend for a patient is to find your pelvic neutral position. So to find your pelvic neutral position, you put both hands on each side of your hips, and then you tilt your pelvic all the way forward, tilt your pelvis all the way back, and then you return halfway. So again, all the way forward, all the way back, and halfway, and that's your pelvic neutral. And you want to stay in that position as long as you can, whether you're driving, whether you're sitting. Throughout your drive or throughout the day, you want to recheck yourself, set yourself an alarm or a post-it note, and again, go all the way forward, all the way back, and 50%. And that's how you set yourself up to the right position. Again, recheck 50-50, legs extended, make sure you're aligned so your rib cage is just above your pelvis and you're not shifted to one side, another, or you're sitting rotated to your computer. You have to be right in front of it. So that's your bottom. Your upper posture is often forward, right? We gotta make sure our computers are right in front of. So if you extend your arm, and each arm is different, you extend it all the way in front of you, you want your laptop monitor or your computer screen to be right in front of you. So it's not too far because then you end up slouching forward, or it's not too high up because then you're tilting up, or it's not too low so then you don't slouch forward to it. So what you do is you lift from your sternum. This is your sternum, your chest. You're gonna lift up. You don't wanna come forward, you wanna lift up to kind of elongate your spine, sit nice and tall. Like for school pictures, you wanna kind of lengthen yourself, be a little taller, and think of like you have an imaginary string in the back of your head and just kind of pulls you up. You don't want to put your nose up because that extends your neck up and then you're in a tilted position. You want to go in the back of your head and kind of lift from the back of your head, elongating the back of your neck, tucking your chin, lifting your chest, and shoulders just kind of fall in the right position. We don't have to pull our shoulders back to sit nice and straight. All we do is from this position, I'm gonna show it again. All we do from this position is just kind of lift up your chest, lift up your neck, and then there you go, you got the right position. So right now I want to show you a few tips that you can do to help yourself prevent an injury. So if you're driving or sitting for extended period of time, the two things that I often teach my patients that they can do is first activate their abdominal muscles, and second activate their glutes, their gluteus maximus. So how to do that is you're gonna find your belly button and you're gonna imagine like you wanna pull the belly button in towards your spine, and thus creating sort of that internal brace to kind of help to brace yourself. Oftentimes people have trouble with that, but the more you practice, the better you get at it. So just pull in, kind of draw. Imagine there's like this string attached from the inside of your belly button, and you pull it in, kind of sucking in a little bit, but still be able to breathe and communicate. You don't want to go too much. You just want to kind of draw it in and hold it for as long as you can. Second exercise is you want to activate your buttock. So you want to just squeeze the buttock as much as you can and just relax a little bit, and then be able to hold it for an extended period of time. You don't want to tighten your legs, or you don't want to tighten your hamstrings. You just want to gently squeeze the buttock and hold it for as long as you can. I often tell patients, start with drawing the belly button separately, hold it for about 5 seconds, and then relax. Again, pull in a belly button, hold it for about 5 seconds and relax. Same thing with the buttock. And then you're going to be able to do them together, so save you a little time. So pull in together, belly button and your buttock, and hold them, and that will help you stay in that good posture for a longer period of time. The third thing you can do for yourself is, once you are done with driving, or you can come up from the computer, is to loosen up your low back. So what you can do is sit at the edge of the chair, spread your legs a little bit. You want to sit just at the tip of the chair, or on a step, or a stool. And then what you do is, imagine like you're rolling forward. So you want to roll from your head all the way down your spine, all the way down to the floor, and then stretch out the back for maybe about 10 seconds. And then you want to lift from your low back. So you're going to lift your low back first, then your thoracic, then your upper back, and the head is the last thing that comes up. Imagine there's a wall behind you, and you almost want to unstick yourself from the wall and then stick yourself back up into the wall. So right now I want to show you a few things you can do for your upper body to help to reduce some of the stiffness in the upper back and tightness in the front of your shoulders. So what I want to do is, there's a joint right behind your neck here that gets very stiff, and oftentimes people sit with their necks and they're kind of pulling on it because they get very tight. So to prevent that, you put both of your hands behind your lower part of your neck, kind of behind right here, and you want to pull them sort of underneath your neck, right when that kind of the stiffness part is that kind of points that sticks out. You put your hands behind there, and then you bring your elbows in together and out separated. You want to bring it in and out, and you want to do about 15-20 repetitions, maybe 2-3 times a day. There's no limit on it. You want to do as much as you can just to get it loosened up throughout the day. You usually won't get too sore from this. It'll just help to kind of loosen up. So that's one thing you can do. Second thing, shoulders get tight as we sit for a long time, driving or in front of the computers, or just watching TV. Sometimes we do that. So what we do is you want to do shoulder rolls. So you kind of round up shoulders from the front to the back. You want to do about 10 of those, and then you do 10 shoulder forward rolls. And that just gets you loosened up and get ready for movement, because you don't want to move on a stiff joint. And the third thing that I wanted to show you is a stretch for the muscles in your chest, because as our shoulders come forward, the muscles in front of your chest get very tight. So find a door frame or a surface where you can put your hands kind of on around, and then you just put your hands just over your door frame. You don't want to push into the door frame, you just kind of gently block yourself, and then you lean with your chest forward and then hold that stretch. You want to feel it right through the front of your chest. Hold it, maybe one leg in front, and you want to hold it for about 30 seconds to a minute, and then you bring it back, and then you want to bring it again, about 30 seconds to a minute. Just opens up the chest, opens up the shoulders. You can change your arm position. You can bring it a little higher, you can bring it a little lower. Wherever you feel the most tightness, that's where you want to stretch. Don't overdo it. It shouldn't be painful. It should be comfortable stretch. About 30 seconds to a minute. I hope these tips and a few exercises helped you with preventing your injuries. If, however, you notice that your symptoms are not going away and you're still having pain, if you notice any radiating symptoms down your arm or your legs, any tingling, numbness, or just have pain that cannot get rid of, you can always contact me at Back to Life Physical Therapy and Wellness. Phone number is 847-809-8183. I am in Palatine. I see patients one-on-one. You can always contact me if you have questions. I will try to help you as best as I can. For Arrow Corp employees, you guys get a discount through my company. Thank you.